Hi, my name is Brooke McKinney. I am the communications manager and artist in residence with Art with a Heart in Healthcare.
What inspired you to be involved with Art with a Heart in Healthcare?
So, I have been creating art for as long as I can remember throughout my childhood, during all of my free time. And it wasn't until actually my last year of undergrad at UNF that I met someone who was like, wow, you love art so much. Have you ever heard of Art with a Heart in Healthcare? And come to find out, UNF offers an internship program with Art with a Heart. It was started by Professor Louise Freshman Brown. And I became an intern in 2016 and I never left it. I found it was my calling, it was my passion, and I've been there ever since.
So, what is Art with a Heart in Healthcare?
So, Art with a Heart in Healthcare is a 501c3 nonprofit organization dedicated to providing fine art experiences at the bedside and in groups in healthcare settings for patients and their families. So, we go in with no actual therapeutic goal or aim. We have no agenda. We go in there solely to provide joy, comfort, creativity to patients during vulnerable times when they need it the most.
So, what kind of art do people create?
All kinds of art. We offer a really wide variety of art supplies from paint and markers, color pencils, clay. They enjoy doing anything they can get their hands on. We have some patients who will spend the entire day with us and will go through the entire log of what we have. And if there's a special project or any supplies that they want that we don't have, we will go out of our way to order it and have it there for them, especially for long-term patients who are like, well, I just spent 8 hours yesterday painting, so maybe it's time to try something else. And we will make that happen for them.
And then being in the hospital is tough. So, have you seen patients' confidence level rise as they create?
Yes, absolutely. Like I said, being in the hospital, of course, it's a very vulnerable time. And especially as a young child or teenager, you have worked so hard to gain this sense of independence and really establish who you are as a person. And a lot of that is diminished by their diagnosis in the hospital, or, they're stripped away from all of these physical abilities or mental abilities that they once had that they're no longer able to do. So art really helps to give them that sense of control back, even if that means they're saying no to doing art altogether. There's not a lot of things in the hospital that they're allowed to say no to. And so we give them that opportunity. And if they do want to create, then they have the choice of what to create, of what supplies to use, or even what they want our team members to create for them. We do a lot of art requests that helps to also just brighten up their room, turn it into their personal art gallery.
And when I was doing my research, I saw you guys actually do art exhibitions created by the patients. Can you tell me a little bit about that?
Yes, I would love to. So every year we partner with the Museum of Contemporary Art of Jacksonville, aka MOCA, and we work with patients at Wolfson Children's Hospital. So these are patients ranging in age, usually from like 5 to 20. And our team of artists come together every year to come up with a unique theme or topic or show question. And we then work one-on-one with the patients in the hospital during their hospital stay to create a work of art reflecting that theme. And the artwork is displayed at MOCA for 5 months. And then after that, it actually travels around Jacksonville to other locations, such as libraries or other cultural centers or universities. And we're particularly excited about our exhibition this year. We will be having a public opening to celebrate it coming up in September on the 15th. That's a Sunday from 2 to 4. The show this year is called The Power Within. So that is based on the idea that our inner strengths, like our confidence, our generosity, our kindness, those are our superpowers. So we really zeroed in on each child's unique superpowers or their unique talents and characteristics. And then we created a fun superhero version of themselves. So it was a lot of fun and using their imagination, but also, like you said, helping to build their confidence and focusing on what is really awesome about them that they can share with the world.
Man, that must feel great.
Yes, absolutely.
So what has some of the feedback been like?
Oh, it is definitely overwhelmingly positive. The community loved, especially they love to see the patient art exhibition. We get a lot of people who reach out to us, just wanting to know how they can support us and get involved. We are on social media, and that's where we share a lot of what we do and where people can get a more in-depth story of our day-to-day and upcoming events and just any way that they can support and get involved.
How does it feel for you to be helping others?
It is incredibly fulfilling to be able to use my art abilities and talents in this capacity. Typically when you think of an artist, you think of someone who maybe spends a lot of time alone in a studio just making art that, maybe eventually people will see. But with Art with a Heart, the art is kind of just the starting point. What really happens, where the magic truly lies, is the cultivation of relationships in the hospital. We're one of the few people who develop non-clinical relationships with the patient, since we do nothing medical whatsoever. And it's a privilege to be able to use art in that capacity, in such a sacred space where healing is happening. And it feels amazing.
How does art help your own mental health?
Art has always been there for me to, just unwind, get lost in the process. I know that it is always a tool in my tool belt that I can go back to whenever I'm just maybe feeling in a rut or wanting to again build confidence, just be like, whoa, I made that. Because people will find that they'll go into it thinking that they're not a talented artist, but then everyone has a sense of pride over what they create, and it's a really beautiful thing for myself and to watch others do it. And I hope it's something that I always will do for the rest of my life.
So where do you want to see the organization, say, in the next 3 to 5 years?
We would love to continue growing within the facilities we are in now. We are looking to expand to more days. For example, we want to go from 3 days to 5 days at the Mayo Clinic, add more days to MD Anderson. We're currently in the lobby. We would love to expand to infusion centers. And in Wolfson, with the children, we are hoping to expand to the emergency room and really be there for children during, that critical time. And then also cultivate new partnerships within the community and be involved in even more healthcare settings.
How can people reach out and learn more?
So like I said, social media is a great way to do that. We are on Instagram. Our handle is Art with a Heart in Healthcare, and as well as Facebook. We have obviously a website, and that is awahih.org, which is just Art with a Heart in Healthcare's acronym. And we are also on YouTube. We have several art tutorials on YouTube that our artists and residents have made. So if anyone else wants to flex their creative muscles, that's a great place to go. We also post on TikTok, and that's pretty much it. Anyone is welcome to give us a call. We love to talk to people, and if they're local, we love to give them a tour so that they can see our organization in action, and they can reach out to us at 904-306-0390.